Good afternoon. I want to thank all of our participants and guests for joining us for today's forum. I'd especially like to thank our Foreign Affairs Committee Chairman, Mr. Eliot Engel of New York, from whom we'll be hearing shortly. Welcome. We are gathered virtually to discuss the status of Haiti amid the COVID-19 pandemic and the dangers of the Trump administration's immigration policy at this time. In December, I participated in a congressional hearing titled Haiti on the Brink. This description is more apt today than it was back then. Haiti is commonly referred to as the poorest nation in the Western Hemisphere. Now, amid a global pandemic, it is uniquely vulnerable. Haiti is just on the heels of trying to arrest a cholera epidemic introduced by UN peacekeepers. The UN promised under Ban Ki-moon to rid Haiti's water infrastructure of cholera and to compensate the victims. They never completed that promise. Perhaps more than any other country in the world, Haiti is woefully underprepared for a pandemic. Even before the COVID-19 outbreak, Doctors Without Borders warned that Haiti's medical system is, quote, on the brink of collapse. A recent survey of 76% of all health facilities found only 124 ICU beds and the capacity to ventilate 62 patients in a country of 11 million people. Having traveled to Haiti and observed its healthcare infrastructure firsthand, I know that a widespread outbreak would be devastating. Most Haitians do not have access to potable water and basic medical care, and many live in crowded households, small tent cities, making social distancing impossible. Alarmingly, COVID-19 is now present in every region of the country, and the number of infections is largely far higher than reported due to severe limited testing and also communication. Consequently, the Pan American Health Organization has warned of an impending humanitarian crisis in Haiti. Despite these dire conditions, the Trump administration has cruelly continued to deport migrants to Haiti, including some who we know tested positive for COVID-19. Deportations in the middle of a pandemic are tantamount to a death sentence for Haitians who don't have access to the same level of health care that is available to us in the United States. My district is home to one of the nation's largest Haitian communities, and Miami and Haiti have always shared a close bond, and my heart breaks thinking of the lasting devastation this crisis could cause to my neighbors and my friends. That is why I introduced the Haitian Deportation Relief Act. This bill would place a moratorium on deportations to Haiti until the COVID-19 emergency has ended in both Haiti and the United States. This legislation is desperately needed to ensure that our government is not culpable in exporting the virus abroad, especially to a nation already on the brink of disaster. I would like to thank those advocating to stop this practice. In particular, I'd like to thank the Institute of Justice and Democracy in Haiti and the Florida Immigrant Coalition, in addition to everyone else on the call. But I also want to make it clear that this is not the time to take our eyes off Haiti's many long-standing needs. Haitians suffer daily, and they protest and demand a better life. The government doesn't listen. nor try to make things better. They're being ruled by one man, one single president, no Senate, no lower chamber, and an appointed prime minister, and corruption is everywhere. We must continue to help this nation recover from years of non-governance, unrest, poverty, and economic ruin. Hopefully, we will leave this forum with an understanding of not only how to stop deportations, but also how to help make Haiti whole. Otherwise, I fear that Haiti's collective problems, which have undoubtedly been exacerbated by the COVID-19 pandemic, will lead to the island nation's utter collapse. I will continue fighting to ensure that the U.S. and its allies do not lose sight of this bigger picture. And now, I'm proud to introduce my friend, Congressman Eliot Engel from New York. He's the chairman of the powerful House Committee on Foreign Affairs. We welcome him to Miami, all the way from New York.
Well, thank you. Thank you very much. And good afternoon, everybody. It's a pleasure to be here virtually with all of you today. I'm still pinching myself about all these virtual things, that they actually work. So I first want to thank my good friend, my very good and dear friend, my colleague in Congress, Frederica Wilson, for organizing this forum and for her tireless Haiti advocacy over the years. No one in Congress, and I mean no one, is a greater champion for the Haitian people than Frederica Wilson. I know her well. I've been to her district. She's a good friend of mine. My son loves her. My family loves her. And you're fortunate to have such a woman of advocacy and effectiveness in getting things done. So when she asked me if I would come and speak, I said, I didn't even stop for a second. I said, absolutely. So thanks for having me here today, Frederica. It's always a pleasure to work with you. And we're going to keep on fighting for Haiti and for the Haitian people. And as you know, we reapportion our districts every 10 years. In my last district, I had New York, Rockland County, New York, which has a huge Haitian population in New York. So the Haitian diaspora is all over and have contributed greatly to America and to American freedom. And I've been to Haiti many times, and we're not going to allow these people to be forgotten. Throughout my time in Congress, I've had the pleasure and the privilege to visit Haiti. It's a country that has endured great hardship with some of the kindest and most resilient people I have ever met in my life. As Frederica said, Haiti is facing a crisis right now, and the Trump administration's cruel deportation policy is adding fuel to the fire. Even before the coronavirus pandemic, Haiti's healthcare system was on the brink of failure. And we've all seen firsthand, even in our own country, just how much the virus can strain hospital resources. So when you have a country like Haiti, which didn't have the infrastructure, it's double and triple worse than you could ever imagine. Even before, again, the system was on the brink of failure, and we've watched this firsthand, and we're not looking away. We're going to be focused on Haiti. But it's downright barbaric that the Trump administration has been deporting Haitian nationals infected with coronavirus back to Haiti, back to a country we all know is too fragile to handle a serious outbreak. We must fight against this injustice, all of us. We must support Haitian Americans and the U.S.-Haiti relationship. Congresswoman Wilson's Haitian Deportation Relief Act addresses this issue head on. If passed, it would suspend deportations of Haitian nationals from the United States until the pandemic has ended in both countries. I'm proud to be a co-sponsor of this legislation as the chairman of the House Foreign Affairs Committee, and I will do everything I can to get it signed into law. We must also extend TPS for the tens of thousands of hardworking Haitian Americans throughout the country, an issue Frederica and I have been working on for quite some time. While our immediate focus is to stop these inhumane deportations, we cannot lose sight of the other critical issues facing Haiti, especially on human rights and the rule of law. These have been central concerns for Haitians over the past few years, and it's easily to say, and I want to say it loud and clearly, Haitians deserve justice and accountability for the violence and corruption they've been subjected to for years. I've joined with Frederica Wilson and other Democratic colleagues in pressing these issues. In particular, Haitians must see justice for the La Saline massacre and accountability after the Petro-Caribe scandal. American leadership is critical in the fight for a better future for Haiti. I hope the Trump administration will join us in this effort instead of fighting against us. It's disappointing to see the failure of U.S. leadership on such a critical issue. Denouncing corruption and human rights abuses should not depend on the political leanings of a country's leaders. Throughout this pandemic, we have an opportunity to put our heads together and really think about whether our current Haiti policy is yielding the best results. I certainly doubt it. Now more than ever, we need the extraordinary Haitian American diaspora community and experts like the ones who are joining us today to come up with fresh, innovative approaches that will help the Haitian people and strengthen the U.S.-Haiti relationship. And as Frederica knows, and many of you know, I've been to Miami many times and have met with the diaspora in Florida, the Haitian diaspora, many times, and we'll be happy to go back as many times as I'm needed. I'm never forgetting about it. I am so blessed to call Haitian Americans my friends, and so blessed to call Congresswoman Frederica Wilson my friend. Most of all, we need people to pay attention and demand action. Your advocacy is what makes all the difference, and I want to thank you. So thank you all for tuning in and staying engaged. We are going to keep this fight, Frederica and I and others in Congress, but she's our leader. We follow her, and we're really blessed to have her as a leader, not only on the Haitian issue, but on so many other issues. So Frederica, thank you for all you do. Thank you for being my friend. Thank you for being my colleague. Thank you for working with me side by side. And thank you for being as effective as you are. But most importantly, thank you for being as nice as you are. As nice as you are. I've been in Congress over 30 years. I've seen them come and go. But Frederica is here. She's come. She hasn't gone. We want to keep her. And we appreciate how effective she is in fighting for these things. So thank you all for tuning in and staying engaged. And now I'll turn it back to my colleagues and our guests. Thank you so much. It's been a pleasure to speak with you, and I look forward to working with all of you, with the Congresswoman and all of you, and making sure the U.S.-Haitian relationship is enhanced, making sure Haiti gets all it deserves from the United States, making sure that we never forget that the Haitian diaspora in the United States is so important and so good, and we need to strengthen it and work with it. We're going to do it. Don't worry. Thank you, and God bless.
Thank you so much, Chairman Engel. From your perch of power, we know we cannot lose as long as we have you working with us. And we appreciate your partnership, have always appreciated it. We love you, and we know that you love Haiti, and we all on this day share the same dreams for Haiti. And you have the power, and for you to join us means so much today, so much, because we know our voices will be heard and they will not just be relegated to someplace else, because we have you, my friend. My friend.
Thank you.
You have always been there for us, and we certainly appreciate it. We will now hear from our expert panelists who will provide context on the current state of Haiti's health infrastructure and how past instability and humanitarian crises have contributed to this current emergency. They also will share information about why continued deportations risk facilitating the virus's spread and the urgent need to halt this practice. Jake Johnston, raise your hand, Jake. Jake is a senior research associate at the Center for Economic and Policy Research and authors of the Haiti Relief and Reconstruction Watch blog. He has also authored papers on Haiti concerning the cholera epidemic and aid accountability and transparency in the U.S. foreign aid system. Cate Oswald, raise your hand, Cate. Cate is the Chief Policy and Partnership Officer for Partners in Health and spearheads PIH's policies, advocacy, government accompaniment, and institutional partnership efforts. In 2014, she led the organization's emergency response to Ebola and has played an integral role in response efforts to the cholera epidemic and 2010 earthquake. Clarel Cyriaque, raise your hand. He's the founding president of the Haitian Lawyers Association and our friend, and has spent more than 2 decades practicing law and representing Haitian immigrants in removal proceedings. Welcome. Leonie, our homegirl, raise your hand. Leonie is the Director of Development, Communications, and Strategic Planning for the Sant Haitian Neighborhood Center and has more than 2 decades of grassroots community experience in Miami's Haitian community, including as Executive Director of the Haitian American Foundation and Deputy Director of the Lambie Fund of Haiti. Leonie has traveled to Washington to testify before hearings for us before, so we welcome her back. And we have Mr. Dan Erikson. Raise your hand, Mr. Erikson. Welcome. You have testified before, and I'm smitten by you. He is the Managing Director of Blue Star Strategies, an international consulting firm where he leads the Latin American practice. He is also a senior fellow at the Penn Biden Center for Diplomacy and Global Engagement and has served as special advisor to Vice President Joe Biden and senior advisor to the U.S. Department of State. I will now recognize Jake Johnston for his remarks.
Thank you, Congresswoman, for the introduction and for convening this forum and really for your leadership on this issue throughout. The introduction of legislation mandating a halt to these deportations is a concrete and necessary step. I'd also like to thank all the other members participating here today, especially Chairman Engel, for prioritizing this necessary discussion. On Tuesday, May 26th, the Trump administration deported 30 Haitians. It was the 8th deportation flight to Haiti since early February. Though the U.S. has pledged to conduct pre-flight testing of all deportees, Immigration and Customs Enforcement is utilizing a 15-minute rapid test that is highly unreliable. Tuesday's flight included at least 8 people who had tested positive in recent weeks and 1 individual who was experiencing symptoms the night before his deportation. Even if testing were improved, the possibility of false negatives makes it impossible to confidently deport only those people who do not present a potential risk to public health. The pandemic is unprecedented. The measures to reduce its spread must be as well. Now, Haiti is not the only country that has received deportation flights from the United States during the pandemic. Since March 13th, ICE has made at least 135 deportation flights to 13 countries in Latin America and the Caribbean. Deportees have later tested positive in Guatemala, Jamaica, Mexico, Colombia, and Haiti. In Guatemala, the government has identified more than 100 COVID-19 cases among those deported. The Trump administration's continued deportations represent a significant public health risk for the region and place a burden on already overtaxed public health systems. The Haitian government, for example, is forced to use scarce resources to quarantine recent deportees while being unable to properly quarantine its frontline medical workers. While this is a regional issue, there is no doubt that Haiti is one of the least prepared countries to deal with the COVID-19 outbreak. In recent weeks, confirmed cases have skyrocketed in Haiti, and with one of the lowest testing rates in the world, this most likely represents just the tip of the iceberg. Before turning things over to my fellow panelists, I think it is necessary to provide some background on U.S.-Haiti relations and place the focus more squarely on the root causes of migration. The Haiti we see today has been shaped by decades of failed aid policies. After the 2010 earthquake, The U.S. led the international community in an unprecedented humanitarian response. Despite the hard work of many members of Congress to provide needed assistance and to focus attention on Haiti, the billions in aid have unfortunately borne little fruit on the ground. The time has come for a more thorough reassessment of U.S. assistance in Haiti. Too often, foreign interests have been prioritized over Haitian interests, and too often, U.S. policy has directly undermined its stated goals, such as sending tons of food aid while voicing support for national production, or endorsing flawed elections while claiming to promote democratic development. For too long in Haiti, the U.S. has prioritized a flawed notion of short-term stability over genuine progress. Now, today, we can criticize Haiti's public health system, but we must also analyze why it is that some 60% of Haiti's health services are provided by NGOs and private actors. The U.S. must do what it can to support Haiti's frontline health workers today, but we must also rethink the policies that contributed to today's situation, and which, without reform, will only perpetuate an unsustainable status quo. Now, changing this deeply rooted relationship will require a sustained focus by members of Congress. In December, at the congressional hearing, my fellow panelist Dan Erikson proposed members form a congressional commission with a specific focus on Haiti. As Congresswoman Wilson mentioned, the need for such a body has only grown in the subsequent months. The immediate priorities of such a commission could be twofold. One, putting an immediate halt to deportations to Haiti. And two, a complete reassessment of U.S. foreign assistance, including an analysis of legislative barriers to aid reform. Supporting national agricultural production, improved infrastructure, and government transparency can no longer just be talking points, or we will find ourselves back at the same place when the next crisis arises. Today, we can and should fight to stop the next deportation, but we also have to approach the issue more broadly and fundamentally rethink the U.S. relationship with Haiti. At a time of such acute health concerns, at the very least, U.S. policy in Haiti could begin with the spirit of the Hippocratic Oath. First, do no harm. Thank you.
Now we'll hear Cate Oswald. Cate.
Thank you so much, Congresswoman.
Thank you.
We're so grateful for your leadership in this important time. Building from Jake's important comments, I just wanted to share my perspective as a public health professional. The practice of continued U.S. deportations to Haiti during the COVID-19 pandemic presents an unacceptable additional burden on an already strained health system. People scheduled for deportation face heightened risks of contracting and unknowingly spreading COVID, thanks to conditions like overcrowded ICE detention centers, confined spaces and vehicles used for transportation between facilities. Deportations not only needlessly accelerate the spread of coronavirus in the Latin America and Caribbean region, but undermine deportees and recipient countries' right to health. For all of us who closely follow Haiti, we know very well that these past 2 years have been exceptionally challenging. Prior to this current global pandemic, Haiti already suffered from serious acute food insecurity and a weak health system. The Haitian government has only been able to allocate approximately $13 per capita on health annually over the past few years, leading to chronically underpaid staff, stockouts of essential life-saving meds and equipment, and inadequate infection prevention and control practices to ensure clean running water and sanitation services. As Jake noted, there have been 8 flights of deportees arriving to Haiti since February. Of the deportees who arrived by plane on April 6th, 3 tested positive for COVID upon arrival, and they were transferred into the care of my colleagues working with our Haitian sister organization, Zami La Santé. For 9 of the 15 years that I've worked with Partners in Health, I lived and worked in rural Haiti as a public health specialist, responding to hurricane-induced floods, political unrest, the 2010 earthquake, cholera, and Zika outbreaks, along with the chronic challenges, of course, of HIV, TB, maternal mortality, and childhood malnutrition. For over 35 years, Zami La Santé has worked in partnership with the Haitian Ministry of Health and Sanitation to provide essential community, primary, and hospital-based care throughout a network of our public facilities in central Haiti. As a response to the earthquake, we worked with the Ministry of Health to build central Haiti's largest public teaching hospital. Today, this hospital serves as one of the main treatment providers for people testing positive for COVID. The hospital received the first known cases of COVID-19 on March 19th, and it has had a continuous stream of patients over the past weeks, some of whom have required weeks of intensive care, with numbers increasing each day. In the past month, cases have jumped from 72 to today a reported 1,443 cases, with approximately 300 currently hospitalized across the country. As many have noted, the majority of testing capacity is limited to 2 main facilities in Port-au-Prince, implying that there are most likely many more asymptomatic cases going undetected throughout the country and potentially further perpetuating community transmission. The Ministry of Health and partners are working quickly to increase testing and treatment capacity as we speak, but Haiti's ability to provide care for people severely sick with COVID-19, especially those requiring oxygen and ventilation, remains extremely limited. This week, healthcare workers have started testing positive for COVID-19, and people requiring hospitalization are quickly starting to outnumber the total number of available beds. We've extended treatment capacity to additional facilities over the past weeks and continue to extend triage and quarantine capacity along the border of the Dominican Republic, where tens of thousands of Haitians have returned over the past few weeks, introducing an additional challenge to containing community spread. As we and other health partners urgently work around the clock to save as many lives as possible from the multi-layered impact of COVID-19 in Haiti, I urge the Department of Homeland Security to halt all future planned deportations until both the U.S. and Haiti COVID-19 containment strategies are better able to ensure that proper testing, contact tracing, treatment, and supported isolation and quarantine capacity is in place. We're not anywhere near that in either country right now, and we cannot remain silent and accept a foreign policy agenda that is currently knowingly exporting COVID-19 to Haiti and throughout Latin America and devaluing Black and brown lives. Thank you.
Thank you so much, Ms. Oswald. We do have another member of Congress on the queue. As soon as we finish Mr. Cyriaque, we will hear from Ms. Barbara Lee. Clarel Cyriaque. Clarel Cyriaque. Miss Barbara Lee. Congresswoman Barbara Lee, my friend, my road dog. How are you?
Oh, I tell you.
Have you joined us this evening all the way from California?
That's right, just got here from Washington, D.C. though.
Oh, you're still in D.C.?
Yes,
Okay.
I did that. I tell you, this is a challenge for all of us. I'm so happy to see you. Congresswoman Wilson, first, again, it's such a delight to be with you this morning from D.C., now in California, now in Florida. So it's wonderful. But I just have to thank you for your leadership on so many issues. This day and time and moment in our history and the history of Haiti come together once again as it relates to the injustices of African Americans and of the Haitian people. And we can't take this out of context as it relates to our U.S. foreign policy toward Haiti. And we absolutely must stop the deportations and pass the bill that you introduced with so many members. And I just want to thank all of the members on this call and co-sponsors of your bill, because this is what is happening now is with this pandemic, we're exacerbating another pandemic that Haiti historically has had. And that is the lack of potable water, the unequal access to healthcare, the lack of infrastructure, all of the issues, the poverty, the instability that we know has taken place over the years. And I have to say, yes, in a large measure, U.S. foreign policy has been part of this. And so shame on us in many respects. And I agree with one of the prior speakers who said we absolutely have to go back after this and look at how we restructure and do work with Haiti in terms of our foreign policy. I am the vice chair of the State and Foreign Operations Subcommittee of the Appropriations Committee. And I'm telling you, as we work on our foreign operations bill, we have got to put resources into the healthcare system in Haiti, but also help put some direction in terms of our partnership with how we're going to help Haiti develop its infrastructure. For many years, we've called for a Marshall Plan for Haiti, but it's got to be done with respect, and it's got to be done with the Haitian people, because they know best how to move forward with their country. And in many ways, we have fallen short on our policies. And once again, now we see the Trump administration with their deportation proceedings and deportation processes in the middle of a pandemic. What kind of signal does that send to the Haitian people about our respect and our concern and our love for them? Now, I have been involved on Haitian issues since the 70s. I used to chair the Haitian Refugee Project, for any of you who were around then. And then we were dealing with a lot of the same issues we're dealing with now. And so after the earthquake, of course, we put in about $50 million to help with the recovery effort. But guess what? A lot of the funding didn't go to NGOs from America, but went to NGOs from Europe and other places. And so we had to put up a strategy to really look at how the funds were being spent in terms of the accountability measures, which we did. And we found and we learned that a lot of the money never really got to the Haitian people. And so, yes, it's our moral obligation to do the right thing right now and stop these deportations, Congresswoman Wilson. And thank you again so much for sounding the alarm. And we also have to go back to the drawing board and reform our foreign policy and our funding priorities with regard to Haiti, so that we can be a positive force in making sure that the Haitian people not only survive, but thrive. We know the history of Haiti. We know how supportive the Haitian government and the Haitian people have been historically. And so we can't abandon and we can't turn our back on Haiti and the Haitian people. And so now's the time, and I think that with all of the co-sponsors of the bill and all of with your leadership, we're building a much broader coalition now so that we can help Haiti right now, but we also have to look at the long-term measures in terms of funding and our foreign policy toward Haiti. So thank you again, and I want to thank all of our panelists. I've had a chance to listen to two of you, and you all have been right on point, and I look forward to working with you.
Thank you so much, my leader. Thank you so much. And now we'll hear from Leonie Hermantin from Miami. Leonie, who is our great friend.
Greetings from Miami. I'm unmuted now.
Okay.
Greetings from Miami. Thank you, merci en pile, Chairman Engel, Chairman McGovern, Representatives Lee, Meeks, Sarkowski, Levin, Presley, and Ms. Tessa Petit, my good friend. A special chapeau bas to you, Representative Frederica Wilson, you know, our incredible champion. Thank you for introducing this bill, which is really a matter of life and death for many of our people. Thank you for the opportunity to allow us, members of the diaspora, to talk to you and tell us about, you know, our position. Gypsy Metellus, Executive Director of the Haitian Neighborhood Center, states very eloquently, should the violation of U.S. immigration rules become a death sentence for immigrants of color? Is ICE playing Russian roulette with the lives of decent men and women? The reality, as it's been stated before, is that there is no safe way to deport during a global pandemic. I'm not here to tell you what you already know. You know that the coronavirus has disproportionately devastated the Black community around the nation. A recently released study, New Orleans study, published on Wednesday, May 27th, in the New England Journal of Medicine, discloses that a disproportionate number of COVID-19 hospital patients were Black. Although 31% of the study's usual patient population is Black, 77% of those treated for coronavirus were Black, and 70% of those who died were Black. So we know that it's the disease that kills us. And we know it, our community, the Haitian community is mourning devastating losses in our communities of New York, New Jersey, Boston, and Montreal. They have sustained as a consequence of this pandemic that they have sustained. We mourn the loss of family members, friends, and co-workers, young and old. And we are still in shock as we assess the financial, mental, and emotional impact of this pandemic is having in our communities in the United States and our communities of color. We know that our communities of color, our immigrant communities, have struggled to access medical help. We know that due to policies such as public charge, even eligible immigrant families have been fearful to apply for health insurance. So we know that as they are deported, these are men and women with pre-existing condition and weakened health systems, health conditions. A member of our community, Mr. Ruben Roberts, president of the Miami-Dade branch of the NAACP, shares our concerns and states, we are in support of immigrants who have established roots in the U.S. We are concerned that they will be unnecessarily exposed to the virus, which has proven deadly to Black communities. And we oppose deportations, especially under these circumstances. ICE, as it's been stated before, is putting men and women at risk in overcrowded facilities. And we've already talked about the flawed rapid testing system. Meanwhile, in Haiti, the situation worsens under the leadership of an extremely unpopular and deeply distrusted president. Insecurity rules as the Moise administration has ceded control of densely populated neighborhoods to violent gangs. So healthcare workers cannot go in there. The nation is reeling under an economy in total disarray. Famine is inevitable as 60% of the population faces severe food insecurity. In the United States, protests have proliferated, our economic future is uncertain, and food supply chains have broken down. The new reality in the US is an all too familiar reality in Haiti. What will happen if the United States makes a conscious decision to further destabilize the nation? Dr. Jean-William Pape, a well-known and well-respected Haitian physician who co-chairs Haiti Multi-Sectorial Pandemic Management Commission, raised concerns about what the future holds for Haiti. Dr. Pape, working with experts from Cornell, Oxford, and the CDC, who have come up with two types of modeling. And the worst case scenario will require 9,000 beds with over 400,000 hospitalizations. We know today that on May 18th, there were 150 confirmed cases, May 16th, 456 cases, May 26th, 1,174 cases. The numbers are increasing exponentially. National and private labs are overwhelmed. Testing is limited, and community spread is happening exponentially. Haitian experts believe that is the tip of the iceberg. There's no need to introduce more potentially sick individuals. By the way, there are less than 1,000 beds available for COVID-19 cases. I will end with a quote from Marlène Bastien, Executive Director of the Family Action Network movement. And I quote, "The intentional exportation of COVID-19 to a country that lacks the most basic infrastructure to care for its citizens, even in normal time, is heartless and reckless. In a prosperous nation of over 300 million, we have lost 100,000 people in under 3 months. What will be the fate of 100 million Haitians if we begin sending sick people to a country that lacks basic infrastructure? The U.S. should put a moratorium on all deportation during this pandemic and free all detainees who do not pose a threat to public safety. President Moïse should hear the calls of his medical experts, members of Congress, and advocates to say no to deportation. Thank you very much for your time and continued effort to fight for what is justice and what is humane.
Thank you so much, Ms. Hermantin. And now we'll hear from Clarel Cyriaque.
Yes, good afternoon, and thank you very much, Congresswoman, for inviting me to this forum. My name is Clarel Cyriaque. I am a lawyer who has for many years represented and advocated for Haitian immigrants facing deportation. I am here today at the invitation of my Congresswoman, Wilson, to address the U.S. deportations amid this coronavirus pandemic. I want to address, in addition to what the other panelists have said, address why Congress needs to act. If not controlled, the coronavirus will devastate Haiti as it has other countries. Containing the virus, meaning preventing or limiting it from moving from one population to another, is perhaps the best way to control it. The US government agrees. President Trump credits his China travel ban for greatly limiting the outbreak in the US. The president's critics essentially agree, except that they think that the ban should have gone in sooner and been more restrictive. New York Governor Mario Cuomo likewise blames not having an earlier Europe ban for why his state was hit as badly as it was. Even China's response to the virus is now seen as a success because China was able to quickly cut off travel from Wuhan province where the virus originated. So containing the coronavirus from further entering Haiti from the United States, which is the global epicenter of the pandemic, is the key to averting a humanitarian crisis, disaster in Haiti. That is why these continued deportations are so troubling. Not only has ICE been deporting Haitians, they've been sending people who have tested positive of the virus. And ICE continue to remove people to Haiti and other Latin American and Caribbean countries, even after verifying positive tests of deportees in those countries, and despite not having a way to ensure that returnees are virus-free. It is clear that the current administration has no intention of stopping the removals, regardless of the health and other dangers that they pose to receiving countries. But unlike China, the US, or even New York, Haiti lacks the power to prevent entry by simply refusing the removals. Guatemala tried it, but it only delayed the seemingly inevitable. In mid-April, the Guatemalan government bought some time by refusing to receive deportees unless they were tested for the virus before being removed. This occurred after 74 deportees from just 2 flights tested positive for the virus upon arrival. But although ICE verified the claim and agreed with the conditions, flights resumed after President Trump signed an executive order threatening to impose sanctions on countries that denied or delayed receiving deportees. The consequences, not surprisingly, were dire. By the end of April, about 20% of the 700 confirmed cases of virus in Guatemala were deportees from the US. And this terrible development prompted Guatemala's health minister, Hugo Monroy, to refer to the US as the Wuhan of the Americas. Given what we know about how failure to contain can exacerbate an outbreak of the virus, this characterization seems appropriate. President Trump has all but called the virus's arrival from China as an act of war. These deportations can also reasonably be seen as an act of war against Haiti and the other Latin American and Caribbean countries. Unfortunately, the Trump administration doesn't seem to care if the US is seen as the Wuhan of the Americas or if its weak neighbors think deportations are an act of war. As an American official told Jonathan Blitzer of the New Yorker magazine regarding what happened with Guatemala, quote, "Decisions are always screened through the lens of whether or not they help POTUS's re-election." The official added, "The White House doesn't have time for Guatemala's BS," to use another word. "Deportations must continue." This is why Congress must act. The US cannot be seen as a spreader of the virus, and the president doesn't get to declare wars. Congress does. Haiti also needs these removals to stop. Everyone knows that Haiti cannot withstand extra burdens. We talked about the earthquake, the cholera epidemic. We also have Hurricane Matthew, the food insecurity, the ongoing political crisis where the president is ruling by decree, and the health problems that plague the country, and of course the coronavirus epidemic. But while we know about Haiti's problems, what the U.S. is doing with these deportations to a vulnerable country like Haiti is a central problem. There are three equal branches of the American government. When the executive branch is causing problems, it is up to the courts and Congress to strike a balance. The administration is being challenged in court over this deportation, but the administration is fighting these challenges, and broad relief does not appear to be imminent. Congress can act right now by passing H.R. 6798, the Haitian Deportation Relief Act, or similar legislation to stop the deportations. Again, I thank Congresswoman Wilson and others assembled this panel, and I move on for the next presenter. Thank you.
Thank you. Thank you so much. We have other members on the line, and they have a hard stop for 3 o'clock. So we're going to ask you to remain within the allotted time. I want to hear now from Mr. Dan Erikson, who I'm smitten by, and he has so many solutions. Mr. Erikson.
Well, thank you very much, Congresswoman. It's really a pleasure to be here today. And I would like to join the other members and panelists in saluting your leadership. And I've seen on the call as well, Representative Lee, Representative Levin, McGovern, and others. And I think it's great to have so much interest. And of course, with Chairman Engel here, who could want more than that? My fellow panelists have really covered a lot of the main points. And so I really just want to focus on two areas. One is to underscore something that you started with, the fact that Haiti was already in a period of crisis before the coronavirus pandemic ever arrived. And today I think that Haiti's at a tipping point regarding this pandemic, and the decisions that are being made over the next few days and weeks by the Haitian government, by individual Haitians, by the United States, the broader international community, and by friends of Haiti, including the diaspora, will play a big role in shaping the trajectory of Haiti's public health crisis and response. And for that reason, today's meeting is of critical importance. Now, Haiti, as we all know, entered 2020 in a very precarious position. In 2018 and 2019, Haiti experienced nearly 18 months of convulsive protests and national strikes that led to the what was described as the pays lock, or country lockdown in Creole. Schools, courts, businesses, public services, and economic activity largely shut down for large portions of last year, which dealt a severe blow to the country's political and economic system. Parliamentary elections that were scheduled for the fall of 2019 have been indefinitely delayed, leaving Haiti without a fully functioning constitutional government. And meanwhile, growing insecurity and a weakened social safety net have left Haiti unprepared to face the coronavirus. On the economic front, the International Monetary Fund now projects negative 4% growth for Haiti in 2020, which is a sharp economic setback in a country of nearly 11 million, where 6 million live below the poverty line, including 2.5 million that live below the extreme poverty line of $1.23 per day. Even before the coronavirus, the World Food Program had projected that 1 in 3 Haitians, or 3.7 million people, need urgent food assistance, including 1 million that are suffering severe hunger. And indeed, we also saw a worsening security situation during the first 3 months of this year. Now, President Moïse in Haiti did take decisive action early on in closing the borders, the airports, many schools, universities, vocational centers, to try to enforce social distancing, although this has been unevenly followed in Haiti. And as my fellow panelists have said, you have seen a dramatic increase of cases, despite the fact that there's very little in the way of testing. Now, it's clear that almost all aspects of Haiti's underlying crisis, including the political, economic, and security dimensions, will now face a public health challenge that will exacerbate current weaknesses. There's a very interesting product that was put out last year that I suggest the committee look at, and the members of Congress look at, which is the 2019 Global Health Security Index that ranks 195 countries in the world in terms of their health security. Haiti ranked 138th out of the 195 countries and was in the bottom 10% of countries in categories such as socioeconomic resilience, infrastructure, environmental risks, and health capacity in clinics, hospitals, and community care centers. So it's going to be very important in this period to really prioritize and focus on Haiti because it is one of the countries at greatest risk. I would just like to begin my conclusion by suggesting several approaches that the Congress, in the form of a congressional working group on Haiti, as well as the U.S. and the broader international community, could focus on to work with Haitian partners to meet the following goals. The first is it's clear that there's a need to scale up Haiti's capacity to manage the likely surge in coronavirus cases. As of May 15th, Haiti only had 4 medical centers with 200 beds treating COVID-19 patients, where, as has been stated, there are some estimates the country will need up to 9,000 beds, and the number of cases are expected to reach over 300,000. Second, it's really critical to address the looming threat of food insecurity. In its most recent update on Haiti, the World Food Program said on April 24th that close to 4 million Haitians need urgent food assistance, and at least 1 million of those are suffering from severe hunger. The World Bank has already donated $9.5 million to support Haiti's food crisis during COVID-19, and the U.S. Agency for International Development has followed suit with new funds. The extension of temporary protected status for Haitians in the United States is my third point. These measures need to extend past the current 2021 expiration date and include the examination of possibilities for humanitarian parole for needy Haitians or for those whose lives are at serious risk. I also think that there's a much bigger role for multilateral organizations here. So my fourth recommendation is to convene a multilateral working group to address COVID-19 in Haiti. The World Health Organization, the Pan American Health Organization, multilateral development banks such as the Inter-American Development Bank and the World Bank, and major international donors like USAID all have a major role to play. But these efforts have to be strategic and complementary. It can't be each agency or entity pursuing its own projects. So I would suggest that each of those organizations, the heads of each organization, identify a liaison to meet specifically on Haiti with other organizations and identify clear lines of effort to help the country through this crisis. Fifth, there is, and I know we're talking a lot about crisis today, there is an opportunity here because there's been a surge in global demand for personal protective equipment, or PPE, and there's a renewed awareness of the benefits of nearshoring these products rather than depending on overtaxed global supply chains. This could provide a potential opportunity for Haiti's manufacturing sector, especially with respect to the underutilized Caracol Industrial Park in Northeast Haiti. So I think that as we look at the new products that are being developed to help the United States, the Caribbean, and the world deal with this crisis, we should see how can Haiti fit in to these new economic demands, and is there a market there where Haiti could be part of the solution to this global problem? And then lastly, and you may recognize this, Congresswoman, because it's a reframing of a prior suggestion I've made, but I really think that there needs to be an emphasis on the political impasse in Haiti, which has taken place over the last few years and is now at a stage where the president has no parliament and is ruling by decree. And so I don't think the COVID-19 pandemic should obscure the importance of this crisis. And I do recommend that the United States convene as soon as possible, and no later than July 30th, a ministerial level conference. It could be a virtual conference of the Haiti Core Group, including counterparts from Brazil, Canada, France, Germany, Spain, the European Union, the United Nations, and the Organization of American States, with the objective of formulating a comprehensive strategy towards Haiti to meet humanitarian needs and lay the framework for successful congressional and presidential elections in the 2020 to 2021 timeframe. So Haiti does not face an easy path ahead. There are still opportunities to manage the worst effects of the COVID-19 pandemic. And I hope that the outcomes of today's conference can contribute to that objective, which will be in the best interest of the people of Haiti and in the best interest of the United States. Thank you very much.
Thank you. Thank you so much. Thank you. At this point, we will hear from members of Congress who are on the line. Joining us are Representative Jim McGovern from Massachusetts, as we heard from Representative Barbara Lee, Representative Gregory Meeks of New York, long Haitian advocate James Jaskowski, all of these are Haitian friends of Haiti and Haitian advocates and co-sponsors of the bill. Andy Levin from Michigan, Ayanna Presley from Massachusetts, as well as Tessa Petit, who is from Miami. So we'll start and welcome Jim McGovern of Massachusetts. How are you, Jim?
I'm doing fine. I hope you're doing well too.
Trying to stay safe.
Yeah, well, listen, I want to thank you for your tireless leadership on Haiti and on immigration issues in general. And I'm proud to be an original sponsor of your bill to stop deportations to Haiti, the Haitian Deportation Relief Act. I also want to thank the expert panel that you helped put together here today. They were incredible. I appreciate their insights on Haiti and the damage being done by the United States continuing deportations to Haiti. I'd like to note that Partners in Health is actually coordinating contact tracing in my home state of Massachusetts. I'm a huge fan of theirs. You know, a constituent family of mine, the Engel family, started a school and a home for orphans in Haiti in Grand Guave because they lost their daughter in the earthquake back in 2010. That was my first visit to Haiti. I went with Mr. Engel to try to locate his daughter who was missing. Sadly, she died in that earthquake along with countless other Haitians. And their family decided they were going to do something meaningful in their daughter's memory, and they created this orphanage and school. I've been to Haiti several times since then, and not only in the capital, but obviously outside of the capital as well. Now Haiti confronts a new catastrophe, the coronavirus pandemic. And rather than helping the Haitian people, the United States is making matters worse by deporting Haitians held in ICE custody back to the island. This is happening not only when Haiti is least capable of tending to the needs of these deportees, but at a time when many demonstrate symptoms or might be asymptomatic carriers of COVID-19. I cannot fathom the indifference, cruelty, and intransigence of DHS, ICE, and the President of the United States in continuing deportations to Haiti, one of our poorest neighbors and a country with weak and limited health care. It goes against all public health guidance and best practices. It goes against all common sense, humanity, and compassion. ICE is just as negligent and reckless, however, with the lives of immigrant detainees right here in the United States, where COVID-19 infections are increasing at a frightening rate. ICE even continues to transfer detainees between facilities, exposing them and anyone who comes in contact with them to possible infection. So I promise that I will work with Congressman Wilson, my friend. I will work with Chairman Engel and Nadler and all my incredible colleagues who are on this call to stop deportations to Haiti, and indeed to stop all deportations, period, during this global pandemic. It is unconscionable that they are happening at all. And I pledge to work with all of my colleagues on this call, especially Congresswoman Frederica Wilson, and trying to create a more humane and effective and responsive U.S. foreign policy toward Haiti, one that respects the people of Haiti, one that is not based on arrogance, but is based on what the people of Haiti want. And by the way, we also should be extending temporary protective status to all Haitians. So again, thank you for having me on the call. Thank you again to the great panelists and to my colleagues, and I yield back.
Thank you. And I want to say to the members of Congress and all of our presenters, this is a press call, so don't leave me by myself for the press. Please stay on the line. Next, Mr. Gregory Meeks from New York, and we're trying to make a 3 o'clock deadline for the press.
Thank you.
Our friend.
And I will be very brief because I have a 3 o'clock deadline myself, but I would be remiss if I did not jump on to say how much I appreciate the work, the efforts, the dedication of Congresswoman Frederica Wilson. She is a focused champion of Haiti and of humanity, and to make sure that as we look to the future, that we make life better for those who do not have much. So Frederica, it is my honor, privilege, and pleasure to serve with you and to work with you on HR 6798, on the various letters that you put forward. It is the right thing to do. And your guests, your panelists that are here, I no need in reciting all of the facts and figures that they have already stated. I'll just say this: the camera of history, and all my colleagues, I should say also, every one of them that you've seen, including my chair, Eliot Engel. I serve on the Foreign Affairs Committee as a senior member there, and on the Western Hemisphere Subcommittee, which is tremendously important, I think, for all of us in our great country, because we share this hemisphere. So I'm dedicated to working to make sure that we do better. But I want to say that the camera of history is rolling right now. We know that we got a lot of work to do in Haiti. But right now, this particular moment in history, when children yet unborn and others look back at where we are and what we did during this pandemic, who we are as a nation, and what kind of heart and soul do we have as a nation? The richest nation in the world, with the poorest, one of the poorest nations in the world, right off of our shore. What did we do during this pandemic? We talk about the pandemic back in the 1900s, early 1900s. Well, they're going to be looking at this. Did we do the right thing, or did we not? We as a Congress need to pass 6798 because we want to be recorded in history as doing the humane thing, as doing the right thing, and deporting individuals to the poorest nation in the world without the facilities to take care of anyone is basically almost committing a genocide. Because if it spreads and continues to spread, how many hundreds of thousands of individuals will be subject to death? That's where we are right now. That's the question that's pending. That's why 6798 is so important. It's so important because it'll penetrate the soul of children yet unborn who won't get to see anything other than what's recorded here as to what did we do. We don't have the benefit of seeing what the politicians said back in the early 1900s, but they will be able to look at the videotape and listen to the mouths and what Congress did or did not do in this pandemic of COVID-19. What did we do? Did we stand idly by? Did we send individuals who were sick back to Haiti to die and to infect others? I hope not. That is why I support my friend, Frederica Wilson, and that's why we've got to support and have passed HR 6798. So thank you so very much, Frederica. I'm with you, we're with you, and we'll continue to fight till we get this done and do the right thing. Thank you, and may God continue to bless you.
Thank you, Gregory. And now we have Miss Jan Schakowsky from Illinois, strong advocate. Jan? We might have dropped Jan. And now we have Mike Levin from Michigan. Mr. Levin.
Hey, it's the other half of the Levin caucus, Andy Levin from Michigan. Representative Wilson, unlike Mr. Meeks, I'm a junior member of the Foreign Affairs Committee and also a member of the Latin America Subcommittee. I will be brief because the Asian American Subcommittee is meeting at 3, so I'm going to have to jump off. But I just wanted to persist and say how grateful I am to you for your leadership on this issue. I'm so proud to be an original co-sponsor of your bill. First went to Haiti 40 years ago while I was still a teenager. And the idea that in 2020, the United States is deporting people, including COVID-19 positive people, to Haiti is an outrage. Mr. Meeks was very eloquent about one aspect of it, but I want to point out something from a public health point of view that no one has quite said yet. Even in a self-interested point of view, it's insane for the United States to be deporting people to Haiti, or as Mr. McGovern said, other countries who are COVID-19 positive. This pandemic knows no borders. This virus knows no borders. And when you spread it around, it's going to come back. And so we are really making a huge mistake in this. I also want to associate myself with the remarks earlier of our esteemed colleague, Barbara Lee. This is part of a long pattern going back hundreds of the years of the United States disrespecting and mistreating Haiti, not treating it as an equal, not treating it as in a truly democratic fashion where we listen to the Haitian people and work with the Haitian people. And so we really need to reorient our whole foreign policy towards Haiti. We absolutely need to extend TPS. And we really need to look at working with all of Haitian civil society, with all of the organizations in Haiti who really represent the people, the neighborhood protection committees, the literacy committees, the unions, all the groups that represent the peasants and working people of Haiti. And only then will we come up with a foreign policy that is really respectful. But in this moment, we should not be deporting people to Haiti or any other country in the middle of a pandemic like this. And it's a shame that we're doing so. And I'm going to follow you, Representative Wilson, and fight until we stop this. So I thank you for your leadership. And I thank the wonderful the panelists. I listened to every panelist and you were terrific. And the information you're sharing was so helpful to us in Congress. So you're making a big difference by educating us about these issues. Thanks, Frederica. I yield back.
Frederica, it's Jan. I'm on. Can I speak?
Yes, Jan.
Thank you. I just want to say Frederica Wilson is a force of nature. And I feel optimistic as of right this moment because you have organized so many members of Congress, so many experts. I believe that with your energy and leadership that we can actually succeed, and we have to. So, you know, to go to Haiti is to love the Haitian people. 20 years ago, I went up to Conge in the Central Plateau, met Dr. Paul Farmer. So, Cate, I want you to know, I fell in love with him and I fell in love with Haiti. And there are great people that are working there as hard as they can to provide health care. And what are we doing as a close neighbor? You get on a plane in Florida, and before you can read the newspaper, you're in Haiti. This is our neighbor. This is our friend. And so we have been for months and months now, many of us, Frederica in the lead, calling and pleading with this administration to stop what it's doing. But I want to make one point. Where are these people that are being deported to Haiti getting exposed to the virus? It is in detention here in the United States of America. The ICE is not doing a good job of controlling the spread in these detention centers. And so what do? We are going to deport it to Haiti and to other countries. Shame on the United States, where we are the really worst in the world in leadership in controlling this pandemic. We know that the ICE admitted in federal court that it said, wait, just one quick second. anyway, that they are deporting people, that they know that people who have been exposed to the virus and people who have the virus are going there. How could we do this to Haiti or to any other country? So we have to really fight back. Haiti needs us at this moment, and it needs us not just to solve the problem of the virus, but we need to be able to help in so many different ways, as been outlined by these panelists. So I hope we can work together and we can make this happen, Frederica, and I look forward to passing your bill, which I'm proud to be an original co-sponsor of, and getting as many members of Congress to join us and to demand justice for Haiti and to stop the deportations.
Thank you. Thank you so much, Jan. And now we'll hear from Representative Presley of Massachusetts, our good friend. Ayanna, unmute.
Can you hear me?
I can hear you now.
Okay, great.
Well,
I'm so sorry that I can't. You can't see me visually, Federica, because I am wearing red today. And I just want to thank you for your vigilance and your leadership. You make sure that we stay uncomfortable on purpose so that we never grow complacent in our work, whether it's for the missing girls, the Boko Haram girls, or whether it's for ensuring the health and safety of our Black boys and men, or our brothers and sisters in the Haitian diaspora. We are just grateful for your leadership and your vigilance, and the fact that there are so many members on this call is a testament both to the extent of the crisis, but really to your influence and your leadership and the respect that we have for you. As a Congresswoman representing the Massachusetts 7th, which is the third largest concentration of Haitians in our country, I am thrilled to be in solidarity with you on this effort. You know, we cannot abandon the Haitian diaspora in their time of need. We've heard the sobering statistics throughout this call, and we cannot recklessly continue to defund development aid and deport Haitians or anyone from the U.S. while we have the highest numbers of affected people in the world. There is no safe way to deport anyone during this pandemic. And again, we know that this is consistent. When it comes to this administration, the callousness and the cruelty is the point, and they have been targeting the Haitian community from the very beginning of this administration. Again, the real fear and fragility that I hear from my Haitian constituents on a daily basis. You know, they have been experienced online slander, repeated efforts to uproot the 50,000 Haitians here on TPS. And so we have to act, and they deserve justice. And whatever we can do to hold this administration accountable as a member of the Oversight and Reform Committee, but also by ensuring that this legislation is passed, we must do. As a body, we have to legislate required alternatives to detention and deportation. COVID-19 has required many industries to change course, and ICE should be no exception. Health tests that check for general wellness are just not enough. They cannot continue to carelessly enact deportation orders that will only raise the global death toll. We can and we should do better for our Haitian brothers and sisters. And I also just want to echo the sentiments expressed by my colleagues and thank our experts for their soberingly devastating confirmation in so many ways, but also with the prescriptive, insightful path forward that they have provided us. So we have our marching orders, and we have our leader in you, Frederica, and we stand with you.
Thank you so much, Ayanna. Thank you. And now we'll hear from Tessa Petit, a Haitian liaison for the Florida Immigrant Coalition. Welcome.
Good afternoon. Thank you. Good afternoon. My name is Tessa Petit. I'm the Haitian liaison and Director of Finance for the Florida Immigrant Coalition. We'd like to thank Representative Wilson for her leadership in ushering this proposed legislation, as well as the other legislators, experts, and organizations joining us today. I moved to the United States in 2001 with my family, despite the strong ties I have to my culture, my people, my food, my land. Although I call the U.S. my home, I still dream of a successful, stable, rich Haiti. What I'm watching unfold in Haiti causes great concern for what my country will look like when I return. Haiti has not yet recovered from the disastrous earthquake that hit the island in 2010, a cholera epidemic, and the decades-long political unrest that have contributed to its current challenges. As others have stated earlier, Haiti does not have the infrastructure to address the pandemic that is now aggressively spreading in the nation. Regardless of the efforts undertaken to curtail the spread of COVID-19, the recorded cases are now growing at a pace of hundreds per day, which numbers we know are most likely grossly inaccurate. The Florida Immigrant Coalition continues to work with and on behalf of the Haitian community across Florida, which is home to the largest Haitian community in the United States. Our dedication to supporting the Haitian community goes from our tireless fight against detention and deportation of immigrants, adequate care in ICE facilities, our work to find a permanent solution for TPS recipients, and to empower our Haitian community by registering them to vote. Partnering with Haiti Toma, a democratic power building movement in Haiti, allows us to also support Haiti and the Haitian in their search for safety, growth, justice, and freedom. We urge all listening to reach out to their representative and ask them to support the Haitian Deportation Relief Act, HR 6798, introduced by Congresswoman Wilson. Exporting the coronavirus through deportation is an inhumane action for all countries, but particularly for a country, Haiti, with a weak health system that cannot protect its people adequately for the moment. In the last 30 days, ICE has deported 11 confirmed COVID-19 cases to Haiti. In Haiti, that means exposing thousands and thousands to the virus. Exporting this deadly virus that has claimed hundreds of thousands of lives in developed countries will lead to a rapid growth in the numbers of lives this illness has already claimed and will continue to claim. This is not about immigration. This is about human lives. Again, I urge all listening, do your part. Help us by encouraging your representative to support this bill that aims at preventing a humanitarian crisis in a neighboring nation. FLIC commits to support HR 6798 and will seek support for the bill as far as its reach goes. This is your opportunity to support Haiti and stop, again, a humanitarian crisis. Thank you again, Congresswoman Wilson, for this initiative and your expressed concern for Haitians and Haiti.
Thank you so much, Ms. Petit. And we know that Tessa is from the Haitian, from the Florida Immigration Coalition. And I just want to give a huge shout out to them because that's the organization that keeps our office informed. Shirley LaFleur, who works in my office, will tell me almost every other day of the calls we get from you to help us know and understand what's happening on the ground in these detention centers and with these deportations of Haitians and what's happening on the ground in Haiti. So we appreciate all that you do and what you do to keep us informed so that we can react. And the members of Congress on this call today can help us as a bond to fight for Haiti. You are totally appreciated. I'd like to once again thank all of the other experts and the lawmakers who participated today and those who called in to listen. I look forward to continuing this conversation with all of you and identifying and advancing measures to support Haitian immigrants and the island nation's long-term well-being. To the Haitian diaspora, there will be no recovery without you. Haitian professionals in Haiti and around the world are critical to rebuilding Haiti and the Haitian community abroad. You must rise up and answer the clarion call to creating a new and better Haiti. You must rise up like Boukman when he sparked the Haitian Revolution by making the freedom of his people his only goal. You must rise up like Toussaint Louverture when he bravely led his army against the world's most powerful forces at the time. Even in his capture, he proclaimed, "In overthrowing me, you have cut down only the trunk of the tree of liberty. It will spring up again from the roots for they are numerous and they are deep. You must rise up like the mothers, sisters, and daughters of Haiti, who are the nation's roots of freedom and have sustained Haiti from being the first and only slave revolt that created a nation to the talented sleeping giant that it is today. Rise up and be strong. God bless you. God bless the Haiti diaspora, and God bless America. At this time, we will answer questions from those listening in. We will start with members of the press. If you have not affiliated with media outlets, please hold your questions. To ask a question, engage the raise hand function in the bottom of the screen and type your name, affiliated organization, and question into the question and answer feature. When you are called on, unmute your link to ask your questions. We're going to ask the members who are still on the call and all of our professionals who have spoken to be available to answer the questions from the press. We'll begin.
Penny Dickerson, your line is unmuted.
Penny Dickerson, you're now live.
Can you hear me now?
A little louder, Penny.
Can you hear me now?
Yes. We can hear you.
My question is, how many Haitians in the Miami-Dade County area have been deported? Is there a documented number for Miami-Dade County?
We can get that information for you. These are people that are being deported from detention centers. So we do have the Chrome Detention Center in Miami-Dade County, where detainees have been picked up from Chrome and flown halfway across the United States and then deported.
Okay. Do you have any idea of what obstacles that you're facing other than bureaucracy, the obvious bureaucracy? What obstacles are you facing with 6798 being passed?
Facing with who?
With the bill being passed, with 6798, with the bill being passed. What do you think is the greatest obstacle with the bill being passed?
Republicans in the Senate. That's the obstacle with the bill being passed. So we have created a whole campaign to call your senator to help us pass this bill. All of the members that you saw on the line have huge concentrations of Haitians in their districts. Massachusetts, New York. So we're asking for those senators to please sign on to this bill and help this bill become law.
Thank you.
Thank you. Thank you. Next question.
Looks like those are the only questions that we have at this time.
Okay, so that was the only question, and that was the Miami Times, which is a local, one of the oldest Black weekly newspapers in the nation. Ms. Penny Dickerson is the editor. And so thank you so much to all of our panelists. It is simply a pleasure to get your input. We compile all of this information. Not only are we trying to solve this issue of deportation during COVID-19, which is dangerous, devastating, and which is going to destroy Haiti if we don't stop it. We tried to work with ICE and friends we have in ICE and contacts we have in ICE and slow it down a bit, but we want to stop it dead in its tracks. And not only that, but once we pass COVID-19, Mr. Erikson has given us so much information, Jan, on what we need to do. So we're going to be working with the Foreign Affairs Committee to come together and put together those agencies and governments that can help Haiti solve its internal issues, including having a fair election. So thank you to all of you. It's certainly a pleasure to have you this evening, and God bless you and stay safe.
Thank you.
Thank you.